This video will explain how to transfer from a wheelchair to a toilet. Here are some important things to keep in mind prior to doing a transfer. Always remember to keep yourself safe during transfers. Do not lift at the expense of your own back. This transfer often requires the individual's assistance, so be sure to communicate clearly throughout the transfer. If the individual cannot direct their own care or express their needs, you'll need 2 people or a full body sling lift. To add strength to the transfer, brace your knees against theirs to keep their legs from buckling. Also, transfer toward the individual's stronger side if possible. This transfer technique can also be used when transferring an individual from a bed to bedside commode. When transferring to a toilet, we recommend the use of a raised toilet seat with arms for additional safety. Bring the wheelchair or assistive device to the toilet. Make sure to stabilize or lock the wheelchair you're transferring the individual from. Remove the wheelchair footrests. During transfers, focus on individual's side with lesser mobility. For example, if the right leg needs more support, plant your left foot and left leg against their right. This will guard the weaker leg and provide more leverage during transfer. Have the individual shift forward towards you and towards the end of the wheelchair. Make sure the individual's feet are planted on the floor and their legs are positioned as if to stand up. Communicate with the individual when you plan to move and provide a countdown to prepare for the transfer. Place your hands along the individual's hips or on each side of the gait belt to help guide their movement. Make sure the individual's arms are on the armrest and that the top of their body is leaning forward into you. On the count, have the individual push up off the armrests as you lift with proper lifting technique. Once in the standing position, slowly pivot and shuffle the individual in a clockwork motion towards their stronger side and towards the toilet. When the individual is directly in front of the toilet seat, slowly guide them backwards until contact is made with the toilet and the back of the individual's legs. While you support them, the individual removes undergarments to prepare for sitting on the toilet. For individuals unable to assist in removing their own clothing, you will want to remove the clothing prior to performing the transfer. If clothing removal is an issue, you may also want to look into obtaining a commode wheelchair or bedside commode. Have the individual reach back with one hand at a time to support their downward movement as you get in a position to lower them onto the toilet. Lower the individual onto the toilet seat using proper lifting technique. After the individual is placed comfortably and securely onto the toilet seat, allow them privacy if they're not a fall risk. Stay close by in case help is needed. Once the individual is finished, apply gloves and provide detailed peri-care to prevent skin injuries or assist with any cleaning as needed. The caregiver should remove and dispose of their gloves, wash and dry their hands, then proceed on with the transfer back to the wheelchair. To transfer back to their wheelchair, assist the individual into a standing position, reapply undergarments, pivot back toward the locked wheelchair, and lower them back down into the chair using your legs. Please visit our sites to learn more about caregiving resources.